Bob Chuckman, and I'm a social worker here at Home Place Centers. Both are women's treatment center and men's treatment center. The men's is called Halton Recovery House, the women's is called Women's Treatment Center. Provide residential treatment to men and women in recovery from chemical addiction. So that's either drugs or alcohol. They have to be looking for solutions to their alcohol or drug problems. So that places our client population as actually at very high risk for potential cardiac arrest. A AED, a defibrillator, actually stops the heart for a second, allowing the heartbeat to reassert itself normally. And in fact, defibrillation is the only thing that will stop VT or VFib, and both those conditions are fatal if they're not given a defibrillation. The type of defibrillator that's most recommended for our kind of facility is, as you said, it's an AED. The price range is approximately $1,400 to $1,800. The $1,400 unit basically takes almost anybody through the process of defibrillating somebody in cardiac arrest. The only main difference between it and the slightly more expensive unit is the more expensive unit has a video monitor that actually takes the person step by step visually through the process of administering the defibrillation. So, the primary benefit of the video is that if one pictures what is going on with somebody in cardiac arrest, they're usually lifeless, and still there's been some sort of, they've probably fallen on the ground. People are panicking, so it's getting the panic level, the anxiety level of the situation down for the people that are actually going to be responding, which is, in this situation, it would be hopefully one of the staff who's trained in CPR. But I mean, in worst case scenario, it could be the closest person to that individual. The video monitor essentially reduces the panic in that situation, and it gives somebody a visual cue to implement the device. There's a movement within North America to have AEDs placed throughout the public setting. So there was a landmark study at Chicago airports. I think especially O'Hare Airport, one of the biggest airports in the world, and they put a whole bunch of AEDs in the Chicago airport system, and they proved that public implementation of AEDs reduced the death rate from cardiac arrest by about 75% over the normal survival rate from cardiac arrest. So in other words, having AEDs placed in public settings drastically reduces the death rate from cardiac arrest.
And that's because?
That's because they're really simple to use. If the person is in VT or VFib, only a defibrillator will allow them to survive. CPR is only administered until an ambulance can arrive. But for instance, in our setting, the average ambulance wait time here is 6 minutes. It's recommended by the Heart and Stroke Association that a person be administered defibrillation within 3 minutes of cardiac arrest to affect the most likelihood of survival. The reason they're called AEDs is because they are automatic, and the ones that we're talking about here are actually semi-automatic. So the machine voice prompts, or as we say, video and voice prompts the user throughout the whole course of administering the device for somebody in cardiac arrest. The difference with an automatic to a semi-automatic, the semi-automatic is actually more recommended because the person doing it has to push the button to administer the shock, which enables no one to be touching the victim or in a source of water that's touching the victim to make sure no one gets shocked by the device. For our purposes, we would be training all of the staff on them. All our staff are CPR first aid trained, but we would be training all the staff on the AEDs. The AEDs of the type we're talking about, though, are so simple, and again, referring back to their use in public settings, that anybody can use them. The unit is designed for anybody to be able to use them.